Now we move on to hear Javier Burgos from NeuronBio. He's going to tell us about AlzTEST, which is a novel tool in blood for the diagnosis of Alzheimer's disease, a great medical need, and I'm looking forward to this talk.
Good afternoon. First of all, I would like to acknowledge to the organizers for the invitation to be here to talk about the work that we are performing in NeuronBio. And of course, I want also to acknowledge to the patients that have been included in the work that I will present in the next slides. NeuronBio is a company of 10 years of history. We are also a public company. We are a spin-off from the Autonomous University of Madrid. We have three main lines. I will talk about the diagnostic line, but we have also a drug discovery and development line focused on Alzheimer's disease, focused in the preclinical stage, and we have also an R&D line. Well, this is the index of the slides that I will talk during my talk. Which is the problem? Well, the problem is that it's a need, an urgent need to identify, to develop novel tools for the early diagnostic of Alzheimer's disease. And this was told by the FDA some time ago in a guidance for industry that they say that it's important to identify novel biomarkers to be included in the clinical trials. Moreover, the Frost and Sullivan analysis also indicate that this is a need, because this is a medical diagnostic need for Alzheimer's disease, and mainly in the early stages of the disease. No work? Okay. Okay. Well, from some time ago, there are increasing efforts in the identification of blood biomarkers to classify correctly the Alzheimer's disease patients. This Nature Medicine is a pioneering work published in 2007 from Ray and co-workers, and they identified the first signature to classify correctly the Alzheimer's disease patients in comparison with the healthy controls. They identify 18 inflammatory proteins that could be very useful to classify the Alzheimer's patients. Later on, there are several papers. Here I show you only two of people working in looking for the biomarker from blood to identify this signature for Alzheimer's disease. More recently, the Gerontological Society of America, in their 2015 working group, indicates that older adults are inadequately assessed for cognitive impairment during routine visits in the primary care providers. There are several problems with this question, is that there is a limited early diagnostic of Alzheimer's disease. This is delaying the treatment initiation of these patients. There is also a delay in the provision of services to family members. Of course, a decrease in the quality of the patients and an increase of the family burden. For this reason, we need urgently to develop a good tool to go to the primary care. For this reason, 4 years ago, in NeuronBio, focused our efforts into look for diagnostic biomarkers, looking for in blood, for a good discrimination between Alzheimer's disease and healthy controls. We have performed a multicentric study working with 4 big hospitals in Spain, 2 in Madrid and 2 in Granada, and this is our collection and the demographic data that was included in the study. We have 80 patients, also healthy controls and other dementias. This is the study flow diagram of our work. We started the study with 579 samples, and we excluded around 200 to do the case control study, analyzing 266 healthy controls and 116 Alzheimer's disease. We analyzed 45 biomarkers in blood using the milliplex technology. NeuronBio is a reference lab, the unique reference lab in the south of Europe for this technology from Millipore. And after analyzing these 45 biomarkers, we choose 23 because they was the best to go to the next step in the study. With these 23 biomarkers, we apply the maximum Jordan index. This is to optimize the biomarkers with a higher specificity and sensibility of the biomarkers, choosing finally each of them to do the multivariate analysis. In this multivariate analysis, we exclude, again, 71 samples for different reasons, and the final studies with 217 healthy controls and 94 Alzheimer's disease. With these samples, we have developed a predictive model using only 5 biomarkers in blood. This is the results of the case control study, and you can see here the markers, the 5 markers, and the 3 demographic data that have been included in the final algorithm to identify the risk to suffer Alzheimer's disease. And in that plot on the right, you can see the area under the curve that is related with the diagnostic accuracy of the techniques is 0.88, that is so good. After that, we have performed several validation, and we continue working in the validation of this tool. The first one was a statistic validation, applying the bootstrapping. Bootstrapping is a technique used for the statistics to evaluate again these 5 biomarkers in 1,000 virtual collections using the previous samples that we have it. In this 1,000 virtual collection, 4 of the 5 biomarkers were included at least more than 900 times, indicating that these markers are very robust. Another different validation that we performed was to analyze another collection of AD patients, but with other different components, such as vascular components, deficit in vitamin B12, hypothyroidism, depression, etc. In these 57 patients, our tool classifies correctly 93% of them. We are working also in the predictive value of this tool, and for that we have analyzed another different collection of MCI people, amnesic and multidomain MCI. There are 87 MCI patients, and the good news for us is that our tool classifies in between the risk in between the healthy controls and the Alzheimer's disease. This is a promising result for us, and we want to perform a longitudinal study to analyze if this MCI will convert to Alzheimer's disease, specifically they that present a high risk in using our tool. Well, we have compared also our result with the literature, and in our 5 biomarkers, 2 of them are shared with the pioneer work of Ray anchor workers. And this work from Ray anchor workers, after that, was analyzed again, the same result by Gomez Rabetti, that is of the different group, identifying that 5 of them are the best for the classification of Alzheimer's disease patients. We share 2 markers with the Ray et al. Work, and 1 of them with the Gomez and Rabetti et al. Well, another thing that we did was the comparison of the features of our tool with the most important academic studies in the world. In this table, you can see here the center where the studies were performed, the number of samples, the clinical entities that were compared for the different tools, the method, the number of biomarkers, the final number of biomarkers for the tool, and the accuracy of the technique. We have the second collection in number of samples. We use only 5 biomarkers, and we have an accuracy similar to the best one, that is the ABL, that is a big consortium in Australia with a lot of numbers of people with Alzheimer's disease. Well, after that, we are a company. We filed the patent. This is the number of the patent. We filed directly the European patent with extended in PCT some months ago. And the advantages of our test, of not only our test, of each blood test to classify people with Alzheimer's disease, is that is patient-friendly, because it's minimally invasive and probably will be less expensive than the other techniques. But the bad news is the clinicians, the gold standard for clinicians is the analysis of the imaging and also the CSF samples. For this reason, this tool is a help for the clinicians, but is not competitive with the classical gold standard that the neurologists are using every day. For this reason, the focus of our tool will be the use in primary care setting in a strategy of the first stage in a multi-step diagnostic workflow. This will be useful to decrease the number of patients that go through the more invasive and costly procedures, and to reduce unnecessary medical services to patients. And there are other papers. For example, this is a paper from June from this year of O'Brien and co-workers, that they showed this plot where the blood screen goes to the primary screen previous to the dementia specialist, and obviously previous to the CSF biomarkers and the imaging. And I think that's all. Thank you very much for your attention. If you have some question, it will be a very pleasure to answer that later.